Hello and welcome. My name is Dr. Calliope. I'm going to be the neurologist who is administering your cranial nerve examination. I do apologize about the heat and humidity. We've had the AC go out as of late. So let me just check on your file here. So it seems that you have been dealing with some neurological issues. Okay, I'm seeing here you've reported some aphasia and memory issues. Is that correct? Okay, and when did this occur? When did you notice this? Okay. And did this coincide with any particular event? A bump on the head? An illness? Okay. And have the symptoms changed at all? Gotten better or worse since then? Good. Okay. Well, with these kind of symptoms here, describing aphasia and memory issues, it would be more prudent for us to do the full cognitive exam, but since we're scheduled for this cranial nerve exam, and it's something we'd have to do anyway, we can start right here. So, your cranial nerves are the nerves that govern different senses primarily. Your eyes, your sense of smell, the sensation on your face. Some of them also have motor functions as well, allowing you to make expressions or shrug your shoulders. So we're going to go through and make sure there's no issue or damage to any of these nerves. And we'll start with number 1. And that is the olfactory nerve, which governs the sense of smell. I'm going to have you occlude one nostril, do right here, okay? And I have some general household spices here that I'm going to have you smell. You could just tell me what it smells like. Okay. Go ahead and close your eyes here. Good. And I'm just going to have you take a little smell of this. What does that smell like? Good. Onion powder here. So it smelled like onions. If you could occlude the other nostril. Good. If you could tell me what this smells like here. Smell it from here. What does that smell like? Now, if you could just allow both nostrils to be open. Good. And we'll do 2 more. This one, I'm going to warn you not to sniff too hard, but just very gently. You could tell me what this is. These are crushed red pepper flakes. Keep this a little the lower side so people don't accidentally get pepper in their nose. And last one here. What does this smell like? Good, that would be cinnamon. You can open your eyes. Let me just jot down that you correctly identified all 4 senses. Cranial nerve 1 is intact with no deficit. Now, for cranial nerve 2, we are going to assess your visual acuity, your ability to see. And for that, we're going to come over here to my Snellen chart on the wall. Alright, I'm going to have you just tell me what letter or number I'm pointing at. So we could start right here. E, F, P, T, O, Z. How about this line right here? Backwards. D, E, P, L. Good. And how about this one backwards? D, F, C, E, P. Good. And here, E, D, F, C, Z, P, okay, D, E, F, P, O, T, E, C. Good. And right down here, L, E, F, O, D, F, C, T. Last line right here, O, E, C, T, L, D, F. Okay. I'm gonna have you just cover this eye for me. And we're real quick just going to do a couple lines. This one, F, E L O P Z D, and then let's do this one. L E F O D F C T F D L T C E O. And if you could cover the other side here. Good. And let's do C E T O P F E D T C F D O F E L. This last line backwards. O E C T L D F. Go ahead and just uncover your eyes. What number is this? 8, 2, 11, 1, 20 over 100, 20 over 30, and 20 over 10. Okay. Visual acuity. 20 out of 20. Vision. Cranial nerve 2 intact. No. Visual deficits. Now, we have a bundle of cranial nerves. We have 3, 4, and 6. This is our oculomotor, trochlear, and abducens nerves. So, I have a little lighted wand here, and it tends to be much gentler than a pen light, and people like the different colors. So, I'm going to have you follow the tip of this light here and use only your eyes without moving your head. Okay? Alright, so you could just follow the tip of this light. We are going to start asterisk test. And that's testing your eye movement in an asterisk shape. We can do the H test, which just has you follow the tip in an H pattern, and then we can also go up, down, up, down, good, diagonally down, diagonally up, diagonally down, Okay. Now, if you could keep looking at the tip of this, I'm going to bring this in. Good. Let your eyes cross and then out. Just keep following it as far as you can. And in. Out. And in, out. There we are. And the other side. Have you follow this. In and out. And out, and in, out. Good. Okay. And just from right here, just follow this way in. Good. Okay. Your eye's ability to accommodate or focus at different distances is intact, and every muscle around the eye is working normally. Now we move to cranial nerve 5. Cranial nerve 5 is the trigeminal nerve. The trigeminal nerve has 3 branches, which is why it has the prefix tri. You have the first branch up here, the ophthalmic branch. You have the maxillary branch along the maxilla, and you have the mandibular branch along the mandible. So we want to make sure that all of these are sensing correctly. The trigeminal nerve also has a motor component. But you've been speaking to me normally, and you haven't reported any issues with your jaw, correct? Okay, well, while we're at it, let's just check. I'm going to have you clench the jaw, unclench, clench, and unclench. Good, so that was the temporalis muscle. Now we'll get to the masseter. I'm going to have you clench, unclench, clench, and unclench. Can you move your jaw down and the side and the other side? Okay, I didn't feel any clicking, and it didn't look restricted at all. How was that for you? Okay, so motor-wise, everything looks great. Now for sensation, we are going to test a few different aspects. Let me gather my tools here. Let's see. Do you prefer more of a higher pitch sound or lower? Okay, let's grab this one then, since it'll be right up close to your face. We're not testing hearing yet. We can keep comfort in mind. Tuning fork or cotton bud. There's my sharp objects. Okay. So the very first thing that I'm going to do is I'm going to test general touch. You could just tell me when you feel the touch on your skin. Okay? Good. Yes. There we are. Good. Good. Yes. Good. Yep. Yes. Good. Yes. Yes. Better. Good. Yeah, a little. There we go. Yep. Good. Yes. It's really raining out there, isn't it? Yes, it is. Now, we are going to test your ability to feel soft and sharp sensations. But my sharp sensation is going to simply be a bit of pencil graphite. As you can see, it doesn't hurt, even though I'm pressing quite deep. It doesn't really feel like anything except for a bit of pointed contact. So, this is what this soft sensation feels like. Right? And this is what the sharp sensation feels like. So if you could just tell me soft or sharp. 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 Soft. Sharp. Soft. Sharp. Sharp, okay. Not much there. Let's see. Okay, we'll keep an eye on that. Sharp. Soft. Sharp. Soft. Sharp. Soft. Soft. Sharp. Still nothing there. But you can feel the sharp. We'll note that down before we move on. So, left side on the mandibular branch. No. Soft sensation. Sharp and general. Intact. Well, let's see if there's any difference with our next test. So, we are going to be testing two more kinds of sensation. We have vibration, which you'll feel on the skin, and cold sensation, which you can also feel with the metal part of the tuning fork. So I'm going to strike the tuning fork. Can you feel the vibration? Yes. And what about the cold sensation? Yes. Vibration. Cold. Cold. Vibration. Cold. Vibration. Cold. vibration. Cold. Vibration. Vibration, cold, vibration, cold, vibration, cold, vibration, cold, cold. Very good. So, the only issue we have is just the mandibular branch. On the left side, we had touch, sharp, vibration, cold sense, intact, save for the above. Okay. Our next cranial nerve test involves cranial nerve 7. This is our facial nerve, and it governs our facial expressions. So if I could have you scrunch up your forehead, okay? Can you raise one eyebrow? Can you possibly raise the other? Okay? Can you close your eyes real tight and open them real wide? Good. Can you smile? And then grin, showing your teeth. For me, it's probably more of a grimace, curse of a partially flat affect. Can you puff out your cheeks? Good. Can you frown? Very good. Intact. Now for our vestibulocochlear nerve. This is a nerve that has to do with balance and with your hearing. So we are going to test your hearing as you've not reported any balance issues. Is that correct? Okay, and when we did look at our Snellen chart, you didn't have any issues moving around the room. So now we're going to jump back in to our collection of tuning forks. forks, and we used this one for sensation. And we'll grab that one once more. We won't use all of these, but most of them. And we're going to start with the lowest toned fork. Now, between the rain and this being 128 hertz, it wouldn't surprise me if you can't hear it. This tends to be the one that, if people do miss it, it's this one. But just let me know if you can hear it. Mm-hmm. Okay. Mm-hmm. Okay. And then let's move up. We're already familiar with this one. This is our 256 hertz fork. Excellent. And the other side. Very good. Now this one tends to be clear as a bell. This is 512 hertz. Let me know if you can hear it. Good, loud and clear. And our last fork may also be a bit tricky. This one doesn't tend to last as long, noise-wise. This is our 2048 hertz fork. Yep. Excellent. Now between these 4 forks, I'm going to be having you tell me whether you hear a higher or lower pitched fork than the one I show you. So what that means is, if I show you this fork. And then I pick another one. Is that higher or lower pitched than the first one? Lower, right. So that's how that will go. So let's start with this one. Is this one higher or lower? Higher. Is this one higher or lower? Lower. Is this tuning fork higher or lower? Good. Is this tuning fork higher or lower? Is this tuning fork higher or lower? Is this tuning fork higher or lower? Excellent. Let's just put these back into their place. The whole family together once more. Now I have 3 tests left, or sections rather, and we're going to start by looking at the vagus and glossopharyngeal nerves. I'm going to test these together. We're going to first look at the uvula at the back of the mouth, and then I'm going to have you take a swallow. We can check for dysphagia. If I could have you open your mouth. Okay, and I'm going to have you say, ah. Good, very easy. You can close your mouth. And now if you could take a dry swallow, like so. Good. Okay. Any trouble or restriction with that at all? Okay. So, we're going to switch the order real quick of the last 2 nerves. We're going to look at the hypoglossal nerve to start, and then the accessory nerve after. Because cranial nerve number 12 governs your tongue movement. So I'm going to have you stick out your tongue and move it to this side. Good. This side. Up. Down. Can you open your mouth and put the tip of your tongue to the roof of your mouth? Excellent. You can close your mouth. Lastly, the accessory nerve. The accessory nerve allows us to move our shoulders, and the easiest way to test it is to shrug the shoulders. So if I could have you just take a few shrugs here. Good. And then I am going to press down on your shoulders. And I want you to press up against me. Good. And I'm going to have you hike up your shoulders. I'm going to try to press them down. I'd like you to resist my pressure. Good. Good strength there. So, we have some notes to catch up on. So, left and right hearing is intact, therefore cranial nerve 8 is intact. We have the vagus and glossopharyngeal nerves 9 and 10. Which are both intact. The accessory nerve, cranial nerve 11 is intact, as well as cranial nerve 12. There we are. So 1, 2, 3, 4, 6, 5, 7, 8, 9, 10, 11, 12. All normal. So, in terms of any neurological issues with the cranial nerves, it looks like there aren't any to be found, but since you've described aphasia and memory deficits, I'm going to recommend you for a full cognitive examination. That way we can gauge the depth of the aphasia, see how bad that is, as well as the memory issues. We can see if there are any other issues that maybe you haven't picked up on. All right? Do you have any questions for me at all? Okay, let me sign off here. There we are. And that will conclude our examination. So you can make the follow-up appointment at the front desk, and I will be more than happy to administer the full kit and caboodle for you we can get you some peace of mind. All right? Okay. I'd like to thank you so much for coming into my office to have this cranial nerve test done. I hope you have a whale of a day and a good rest of your night.